On the COVID front tonight, we continue to track an uptick in cases. 103 cases confirmed in our region just today, and 70 of those came from Jefferson County. Around the country, the highly contagious Delta variant accounts for 83% of new cases, and Southeast Texas health officials admit they are concerned.
They tell our Amelia White that they're already making preparations for another surge. She joins us with a look at the steps that they're taking.
Jordan Dage, now two things are causing the rise in cases: the Delta variant and the slow pace of vaccinations.
We're just not there yet. We're not at the end of the COVID-19 crisis.
I've worked with the entire pandemic, and it's just very concerning to think that we're facing the same thing again.
Over the last few weeks, numbers have increased dramatically.
The recent uptick in cases isn't lost on Sherry Miles and Rolanda Ford. Miles is a nurse practitioner who works with telehealth calls.
What I can tell you is that I had no new COVID calls until the end of last week. All I had was follow-up calls from patients that had already been sick.
And Rolanda Ford works with COVID-19 inpatients at Baptist.
The population that we're seeing and treating and admitting now is younger. You know, we're treating 20 to 50-year-olds.
Both agree it feels like deja vu thanks to the Delta variant.
So this strand is hypertransmissible, which is a huge threat to our community.
Baptist pulmonologist Dr. Kamar Arfin says available hospital beds are dwindling.
The hospitals always are almost at the capacity. Majority of the patients who come with COVID pneumonia, it takes them days and sometimes weeks to get better.
In Jefferson County, the COVID hospitalization rate is a little above 6%. Staffing is a real concern.
When the numbers go up, we still only have the same amount of healthcare providers that we always had.
Health officials are in surge mode, gearing up once again for what's to come.
We have, in the past, we always been a step ahead, and that's, having a mobile unit if there's a need for it to house those patients.
Health experts are expecting to see a peak in cases that are driven by the highly contagious Delta variant around mid-September, so we still have a little ways to go. We're live. Amelia White, 12 News.
All right, thank you so much, Amelia. As we continue to see an uptick in cases and hospitalizations, we just wanted to pass on some recommendations from the CDC.
Yeah, what should you do if you're fully vaccinated? Well, at this point, and you come into contact with someone who has the virus, the CDC says you don't have to quarantine if you don't have any symptoms. You also can refrain from testing following a known exposure if you're asymptomatic. But if you're showing symptoms, do get tested and do quarantine.